One of the major goals was to make sure that we would relaunch the in-person activities. Of course, that to some extent we had no control whatsoever, but fortunately, although the pandemic is not over, but it has improved to a point where we have been able, after 2 years, having an exclusively virtual meeting to have people together. And I can tell you that even today being the very first day of the meeting, people are so excited, expressing this happiness of being in person. So that was really one of my main goals for the society. And in fact, this is not the only in-person activity that we are holding. So there have been many other educational courses and also a Pan-American Congress. But in addition to that, when I took over last year during the then virtual Congress, I made it clear that the most important priority that I was tackling during my term as MDS president is to get back to basics, to clinical care. Our field has improved in terms of science, and of course we are not neglecting the role of science, but clearly there is a growing number of people with movement disorders around the globe who require proper care. And so that's the main mission, is really to draw attention to this group of people and to provide education in terms of improving the care that they receive. One of the questions is education. And our major mission has always been education, providing the best possible education in movement disorders. And I would really like to draw attention that although we are predominantly a medical society, but not exclusively, and in fact we have had a huge effort to try to reach out to other healthcare professionals. So right now it's clear that this interdisciplinary approach to providing care is very, very important. So what is this is related to your question, that we are really trying to educate as many people as possible, and also trying to motivate our members to improve on the ground access of people who have movement disorders to these teams who are being trained at a global level. And finally, one important point that you may know, many people who are watching us may know, that 50% of patients who are identified with Parkinson's disease in epidemiological studies, they had never received before a diagnosis. And this is not only in underdeveloped areas or developing world, even in other parts of the globe. So that means that it is necessary education, not only in terms of the care itself, but in recognizing these conditions, because otherwise these people will never have access to treatments, including medications and allied health professionals and so on. So our main focus is really on educating people.